This idea of social competence. This is a complicated thing that we spend a lot of time thinking about if we think about autism. And in fact, in the earliest conception, from its earliest conceptions, the idea of sort of struggling in the social world, sort of feeling behind this glass wall, has been, part of how we've thought about autism. And, increasingly, right, we have concerns about across the lifespan, social isolation and adverse mental health outcomes that can emerge. And I often describe this as sort of the largest and the smallest distance in the world, right? She feels so close but so far, and we need to. One of our work has been about trying to figure out how we bridge that gap. But I think it's important that we also realize that here we are in the mid-2020s, that the landscape has really changed. With the rise and embrace and understanding of the neurodiversity movement, which of course has actually been around much longer than the last 10, 15, even 20 years, there is growing appreciation and understanding that autistic ways of being and autistic socialization need not be considered as sort of a matter of pure difference, pure isolation, and that we can actually better understand and embrace ways of connecting that work for folks on the spectrum and that validate who they are. But why have we assumed that autism is so very much about social disconnection? Where has that come from, and how do we interrogate some of those assumptions? And so that's where I want to start here today, is by doing some of the work that our team and others have done, interrogating various different assumptions about the nature of social challenges in autism. The first assumption is this, an old bugbear, at least of mine and others in the field, which is the idea of social knowledge. So this is probably one of the oldest assumptions in the autism field, and I often describe it as sort of the layperson's theory of autism, which is to say, if I walk down the street of Sacramento and I grab somebody on the street and I said, I work with teens on the spectrum, and there's this guy that I work with, and he's great and he's so much fun, but he doesn't have any friends. Why doesn't he have any friends? The first thing they would say back to me is, please take your hands off me. Why are you grabbing me? And then they would say, I don't know, maybe because he doesn't know what to do. And know what to do is a long-standing assumption of our field, right? That sort of the way we've thought about and conceptualized social challenges in autism. But know what to do is an empirical claim that has not often been tested historically in the field. So social knowledge, if indeed exists, is about is something that we could measure. And in fact, there have been measures of this for 40 plus years. So for example, I could give somebody a questionnaire and ask them things like, ready, there's about to be multiple choice, guys, so everyone pay attention. When you first meet somebody, should you A, stand there and say nothing, B, punch them in the face, C, put your hand out to shake theirs, or D, run away screaming? And the answer we are looking for, folks, is, shout it out. Yeah. So most of you said C, nice job. I heard at least one B, to which I would say, if there's a reception after this, I would encourage you to email me instead. Right. So the idea is that, we could ask people their answer to questions like these. And if indeed autism is defined by social knowledge challenges, on average, autistic folks should answer C to questions like that less frequently. And doing it more should be related to doing those things more if we actually observe them, right? And we and others have done now several different, relatively large studies looking at this question, and over again come up with the same answer, which is nada. Nothing. We find that on average, autistic folks, teens at least, do not get these questions wrong at a lower rate or at a higher rate than those not on the spectrum. We do see a wider range of responses in the autism groups. So in our studies, the autistic youth are there's usually a few who are the only ones who actually get every single question right. And then also, though, there are folks on the spectrum who are truly guessing. But we find that no relationship between that and any of the outcomes that we might think of as caring about. So the question then is why? Why have we thought this? Why have we assumed this for so long? So Jackie Gates, my grad student, published a great paper in child development. She got a shout out from the IAC for it, trying to answer this question a little bit. And so we recruited a bunch of teens on and off the spectrum, and she used a measure, both parent and self-report, we're just going to talk about parent report today, of social profiles. And so what it does is it sort of disambiguates the social profile of folks into three domains. One is sort of knowledge or acquisition. Basically, does this person ever do this? The second one is performance, so sort of maybe does it sometimes or seems to know how to do it but doesn't always, or strength, because we should also acknowledge and realize that social strengths are also important in a profile. She did not invent this measure, we adapted it from other populations. And so here's what we find. We find that, yes, on average, the non-autistic group showed higher levels of social strengths. So this, on the y-axis, just to be clear, this is like percentage of the overall profile. So the idea is like, if a person had 100% of this, it would mean that every single thing that was asked about in this measure was a strength, right? So about like, 20-ish, 20, 22% for the non-autistic group, about 12 or 13% for the autistic group. The autistic group did show higher social acquisition or knowledge challenges, but I would note, and we'll get back to this in a minute, still relatively few, about 8% of their total profile. And really the big piece was performance challenges. So the autistic group showed significantly more, much more, both statistically and also clinically significantly more social performance challenges. So meaning about 30% of their profile was essentially knowing what to do but not always doing it. So I want to zoom in for a second just on the blue bars here, same data. We find that, yes, autistic teens showed significantly more performance deficits challenges than acquisition challenges. And I think that's very important, right? That really this idea that this defines autism was not supported by the data. And if anything, from a social standpoint, performance challenges might be more helpful to understand. And we'll get back to that. So performance was much more of an issue than knowledge. And performance did outstrip social strengths, but I think it's also important to realize this, that even in this sample, these autistic teens are showing significantly more social strengths than social knowledge challenges. Social strengths, not like strengths in other skills. Actually, this is something my child is good at socially. Not how we traditionally conceptualize social stuff in autism, right? So why? Why do we think this? And I think it really has to do with a perception problem, which is this is parents, right? And knowledge, the way that this measure works is if I'm a parent, I've said, this is important to me, and my child is never doing it, as opposed to this is important to me and my child does it like a lot. And as a parent, I can tell you, let's say that the task is, opening a door for somebody. And I'm like, I've decided that this matters a lot to me. My child should open doors for people. And I've never not once seen him do it. And that really upsets me. And so what do? I focus in on that. And I say he needs to learn how to open the door. I'm going to teach him to open the door. Someone's got to get him to open a door for people. Right? But, and so that I think becomes then our focus for intervention. But then we are actually the ones missing the forest for the trees, because we're focusing on something that really is a relative rarity among the overall social profile of these individuals. And I will say, for those of you who are intervention researchers in the room, another way to look at this graph is the maximum amount of variance you can get out of your intervention. Because if you are targeting this, what this says is if you want to change, affect the social experience of folks on the spectrum, the maximum amount of variance you could get. If, let's say you solved all of this with your amazing magic social knowledge acquisition intervention, you could only affect 8% of their total profile, which, for those of you, again, intervention researchers in the room, you would be too bad, so sad if that was a maximum amount you could get out of your intervention. Whereas here you're talking about 30%, or if we actually focus on bolstering and supporting social strengths, we can get way more. So this is all by way of saying, whoops, we maybe need to rethink this primacy of social knowledge as a challenge. So what about quantity? Another assumption that's often made is that autistic folks may just have fewer interactions than other people. So Alan Gerber, former grad student of mine, now he's at Children's National, did a really neat study. So I talked to some of you about some of the underlying data of this. This is this app study that we did, where we took young adults on and off the spectrum. And there were other conditions, which I talked to some of you about before. Don't worry about them for now. But basically, we had them tap on their phone every time they had a social interaction throughout the day over the course of a week. And so the idea was we could sort of map the amount and the rhythm of social behavior. And so Alan had this idea that there might be sort of a diurnal rhythm of socialization. And it turns out there actually was across everybody. There was a sort of interesting diurnal rhythm of social behavior, right? We all can eat a little food before lunch, then we kind of go away from everyone. And, right now I'm talking, but you're not, right? So anyway, it kind of goes up and down over the course of the day. Neat. It follows a sine function. But the question was, does this differ for folks on and off the spectrum? And what we found was that, oops, I gave away the punchline. If you looked at these two graphs and you're thinking, gosh, I'm not seeing much difference between the autism and the non-autism group, you're correct. So they didn't differ either in the mean amount or in the rhythm of their social behavior. So young adults on the spectrum are not showing less social interaction or sort of like an arrhythmic social interaction relative to non-autistic young adults. So whoops, not that. But what we did find was this. So for those, how many of you are not familiar with alexithymia in this room? KK, cool. Hi. Alexithymia is a clinical phenomenon wherein an individual shows difficulty reading their own emotional state. Maybe like if you're filling out a questionnaire on it, you might answer questions like, other people tell me I seem mad, but I don't feel mad, or I don't think I'm mad, right? Things like that. And it turns out alexithymia is extremely common in autism. Some studies suggest 70%, up to 70% of folks on the spectrum experience co-occurring alexithymia. And when we parse that out in these data and just look at alexithymia levels, that is actually what's impacting amount of social interaction. So this is after controlling for autism. It turns out that it's there. The co-occurring this is the same data just as a correlation. Co-occurring alexithymia that seems to be giving way to reduced social interaction, which again, if your goal is to increase social interaction, we should think about what we're actually targeting, right? So it's not necessarily about autism, but it might be about helping folks to identify their own emotional state. So what about another phenomenon? This is this idea of social information processing speed or efficiency. This is actually something we've learned from our autistic friends and colleagues in the community who will often say to us, the challenge for me, I know what to do, I have plenty of interaction, but it's sort of keeping up with that pace of social interaction that's sort of a lot. I feel like I'm just a second behind. I can't quite keep up with it. So we kind of looked into ways to measure this. So we use in our lab EEG, electrophysiology. This is my oldest child, Evie. She says hi, from years ago, measuring, showing how you wear this cap. And basically, when we do EEG work in our lab, we're looking at a couple of different components in both the face and voice domain. In the face domain, we look at what's called the N170. This is a component associated with sort of initial face identification orientation, sort of your brain going, that's a face, as opposed to a non-face thing. And then we also looked at something called the N250, which is a later component associated with emotion decoding. And this is sort of roughly nominally where these components are coming from in the brain for those who care. There is a corresponding set of components in the voice domain that kind of correspond to like initial decoding. This is a voice, not a non-voice thing. Identifying some other information about it, and then finally emotion decoding. And again, we have sort of a similar kind of lateral cortical sequence I can tell you about if anybody cares about that. So one thing we found in terms of this work is that actually within autistic people, we see a pretty high what's called cross-modal correlation. So basically, if you're fast at that initial component, that initial orienting, this is a face or this is a voice. Not at the later stages, but that initial, hey, I'm orienting this as a face or a voice. The faster you are in one, the faster you are in the other. And so this is sort of like the latency, how quickly your brain does it. And so that's kind of neat and suggests this sort of like unified social sort of information processing speed circuit going on in the brain somewhere. But then what we also said is we looked at that in relation to emotion detection. And what we find is that actually within both the face domain and the voice domain, the faster, so further on the left, folks are doing this, the the better they're doing at actually decoding emotions, identifying emotions accurately in faces and voices. So that's kind of interesting and actually supports the intuition of many autistic people who will tell us, gosh, it's like if I can just keep up in those moments I feel like I can sort of can catch that social interaction, I can do just fine in decoding that emotion. Interestingly, Erin Kang, a former grad student of mine now at Montclair State, did a kind of this big meta-analysis of the N170, and she did find, and this is now has been through the Jamie McPartland's ABCCT, they've kind of followed up on this, that this does seem to be sort of a factor that does differ on average in folks on the spectrum, but there are individual differences in this. But we wanted to really kind of interrogate the underlying assumption here a little bit further, which is this idea of, is the ability to do that, is sort of that underlying knowledge of those emotions kind of in there, right? This, again, really this deeper knowledge claim. And so Juan Mayer-Torres, former postdoc, as well as Drs. Tessa Clarkson and Kate Hochschild, former grad student postdoc of mine, did this really interesting machine learning work where what they did was we looked at this single trial level of our the EEG data. So literally just we fed the squiggly lines into our deep learning machine and asked it at a single trial basis, what emotion is this person looking at, based just on those single squiggly lines. And the underlying idea being that if it can do that at a similar rate for autistic and non-autistic people, right? It suggests that that information is encoded in there, right? You can extract that information from that EEG data. And we replicated this in 3 independent samples in this paper, and what we found is that, yes, there was differences in behavior, so autistic folks, this is young adults in these data, did show had a little bit more difficulty reading emotion, like when we actually asked them, tell us the emotion that you're seeing. So the behavior, the output was different. But the actual underlying, the convolutional neural network basically was giving us the same level of output, meaning the information is in there, right? Folks on the spectrum, the claim that autistic people sort of don't know or don't know the underlying emotion there is not supported by these data. And this is the same data from a different angle, and then this is actually sort of looking at the time series of it and what components of that neural information are contributing to that. And what we do find is that autistic folks are processing that information a little bit differently. This is taking a little bit longer. But the information, crucially, is in there, which again augurs against this old knowledge claim. So it's not really a problem with really knowing emotions. So what about this old idea of theory of mind, right? This is something that folks have thought a lot about in the autism world, and again, in current literature, I think there's an appreciation of the fact that it's more complex, right? That we should not just assume that autistic people don't understand perspectives. We know better than that. But again, I want to get at this why. Why have we assumed these things? And so Aaron Libsack, former grad student of mine, now postdoc at Rutgers, did this clever study using a kind of cartoon-based stimulus program where she looked at used examples like this. So this is one of the cartoons. So Dahlia wants a puppy. Dahlia sees a puppy on the side of the road. Dahlia asks her dad for the puppy, and her dad says no. Why is Dahlia sad? And then each of these stimuli are shown one at a time. We time walk to them, and the questions are, Dahlia is sad because she wants the puppy. Dahlia is sad because of something that happened at school. Dahlia is sad because the puppy wants to play with the ball. And the first one would be like the sort of quote-unquote correct one, right? And so we can look across these, and what we do find is that there are, on average, and this is not really the interesting information, but on average there are differences in terms of in what's called the LPC, late positive component, which happens around 300 to 600 milliseconds, between these groups, where in the non-autistic group there's sort of a differentiation between the response to the quote-unquote correct answer and response to the other responses. In the autistic group, there's less of that. But there's a lot of individual difference. And so here's what we find that's really interesting. We find that, yes, on average in our group, if you have a higher score on, let's say, our ADOS, we see more challenges with theory of mind. But it turns out that it is mediated by this LPC. So what this means in practice is that if you have a high score on the ADOS, but your brain is sort of doing this thing the LPC does, which I'll tell you about in a second, you do just fine on the theory of mind measure. But if it doesn't, then that actually is what's giving way to theory of mind differences in this. And what is the LPC? So the LPC is this really interesting perceptual component that's involved in what's called meta-representation. And my developmental psychologist friends in the audience know what I'm talking about here. Right? Know what I'm talking about? All right, so meta-representation. So it's the idea of being able to say, okay, I can take this stimulus, like this thing, and abstract it in my mind so I can do things with it like imagine. Like being able to hold this in my mind and pretend it's a phone or think it's a spaceship, right? And there's this sort of intermediate step that's involved in doing that. And the LPC appears to be a component that's responsible to that. So it suggests that actually it's not fundamentally a theory of mind challenge at all, but that instead it's simply this ability to abstract from initial stimulus. And what's cool about that is meta-representation is something we actually know quite a bit about in terms of how to, help support people with that if they are somebody who struggles with that. And importantly, it's not really it's not stigmatized, for instance, in the same way that saying somebody, oh, they struggle with perspective. It's actually not that at all. It's just holding abstract ideas, abstract stimuli in mind, which we can do. So what about this other assumption, this assumption about friendship? So Jenna Mendelsohn and Jackie Gates and I did a paper about almost 10 years ago now, where we kind of meta-analyzed this question of, do autistic folks struggle to make friends? We find that on average, actually, autistic kids do make friends, and it's important that we remember that, but that they are often of a different sort of quality, and they emerge in different ways. So this then led us, based on the previous information too, to sort of try to develop a new model for how autistic friendships come about, suggesting that some of these factors we're talking about, like that social information processing speed thing, might, for instance, either facilitate or get in the way of ability to engage in, say, some of the deeper emotional sharing experiences that sometimes, at least in neurotypical people, give way to some of these deeper structure friendships. So this suggested to us that we might be able to start to understand and unpack a unique model of friendship making in autism. Which meant we should probably actually spend some time looking at friendship making among autistic folks, right? And so so Jess Granieri did this, where we brought in groups of teens on the spectrum and basically asked them, after hanging out for a little bit, who is your friend? And asked them about friendship nominations within those groups to see how they make friends with one another. And what we found here, so Jess had this clever idea of looking at the ADOS and looking at items on the ADOS to see whether or not and how they relate to friendship making within the group. And what we found here is that two items in particular, there were other relationships too, but these are the ones I want to highlight for you that made the most difference. Reduced eye contact and reduced facial expressions were related to more reciprocated friendships in teens on the spectrum. Less eye contact, less facial expressions on the ADOS. So for those who score on the ADOS, these are 2s on those items, where she actually showed greater friendship making among folks on the spectrum. Once again, one of the themes of this part of the talk, I'm hoping you're getting the message, is whoops. Whoops. Because these are factors that we often try to spend time teaching folks on the spectrum. We say, oh, you should remember to make eye contact, right? Remember to, read the facial expressions of others, express how you're feeling. But actually, at least among other groups of autistic teens, those things were deterrents from friendship making. And that perhaps it was, for instance, like an overwhelming stimulus or a lot to manage or, stressful, whatever. We don't know the why, but what we can say is that this, again, points towards we have to do a better job of understanding and thinking about the way autistic folks are making friends and building community in a way that does not rely on these assumptions that we've made for so long. Erin then did a really, I thought, very important paper a few years ago, looking at this phenomenon, this sort of meta-phenomenon of passing as non-autistic, right? That this is a thing people who talk about camouflaging, they talk about masking. PAN is sort of the umbrella term now, over all of those things. And what she was able to sort of find in this literature is that this is a really messy construct we need to do a much better job of measuring, because it's a real important and deeply misunderstood thing, but we need to better understand it, because this is a phenomenon we're hearing about all the time, particularly as folks are being asked to not be in groups of, say, all folks on the spectrum. So Abby Hulk and Talina Day and others, I have a paper, we just got minor revisions on it, should be out soon, trying to actually identify some metrics of panning, trying to understand what goes into passing as non-autistic. And so in this project, what she did is we looked at the discrepancies between contexts of expression of autistic presentation. So what I mean here is these are folks for whom we had teacher scores on the SRS, so teacher ratings, and ADOS scores. And so when you're looking here, for example, this is, let's say we'll start an easy one. Well, if you're looking here, these are folks who have low SRS scores. And by low, and this is sort of a standardized, but like low SRS scores, like this is a community recruited group. These are not folks coming in for a clinic visit. These are folks who, you would not, wouldn't show up necessarily to a study at the Mind. For example, 4 folks on the spectrum. They have like an SRS of 50 or less. And they have low ADOS scores, right? So these are folks with sort of concurrence. But here, this is somebody who's panning. So they have very low teacher score. So as in their teacher would never be making a referral to them. They wouldn't think that this person's on the spectrum, but they come in and their ADOS score is like an 8 or a 9. And what we are finding here is that in this group, if you kind of map this as an interaction effect, that on this particular ERP component called the LPP, late positive potential, when looking at faces, there's a unique profile for those who are panning. And particularly, the LPP is thought to be an index of emotion regulation in the face of social stimuli. And so the suggestion here is that maybe what's happening, one of the mechanisms of panning is sort of this differential emotion regulation when faced with social stimuli. So that might be one of the ideas. So let me pause for a second and summarize what I've told you so far. When we're rethinking our assumptions about social competence, social knowledge might not be as important as we thought. That amount of interaction maybe is not less, but maybe alexithymia matters more than we thought. That social information processing speed, as suggested by our autistic colleagues, might actually matter more than we thought. The reading emotions is intact but different. The theory of mind is maybe just a difference in meta-representation ability. And that, yes, we need to understand friendships, and that PAN is a measurable process, and we must support a neurodiverse model of social competence. So how do we do that? And how does that inform how we help? Well, one idea, of course, as Marjorie said, is there's this whole literature on social intervention. In fact, you could spend your whole paycheck going online and buying all the manuals on Amazon for how to do this. But the big question we have to ask is, do these things work? Who do they help if they do help? How do we make them better, and how do we share and disseminate that information? So that's one thing that we've been focusing on as well. All right, we're doing good. Right? Okay. So, time-wise. Jackie and Aaron a few years ago did the largest meta-analysis yet done on social interventions, saying, do they work? Do they work better than nothing in these randomized control trials? And on average, the answer was yes. And for those, again, who do meta-analyses, is a G of about 0.5. So kind of a modest effect. But the really important question is according to whom? So according to parents, folks on the spectrum, these interventions are working kind of a little bit. According to some observers and some task-based measures, yes. Interestingly, according to teachers, no. So this meta-analysis suggests that social skills interventions don't work for school-based social behavior. Whoops, again. But the important thing I wanted to know was, what about our teens on the spectrum themselves? So what we initially found was a little bit shocking to me, which was actually the self-report measures were the largest effects of all. They were about twice the size of the others. And we're like, wow, all these autistic teens are saying that they're doing so much better after social skills interventions. Who'd have thunk it? What an interesting finding. And then I thought back about this knowledge performance thing. And I thought, what are we asking them? So I had some poor undergrads go back through and dig through all of these papers and differentiate between studies where the outcome was knowledge, as in, did you learn, like, what are the rules? Like, they asked them basically a quiz before and after, or performance. Are you doing these things? And what we found was that when social knowledge was the outcome, it was actually an even bigger effect. It was the biggest effect of all in this whole study. So teens are learning rules. We bring them into a group to teach rules, and they're learning those rules. But when not, when the measure is actually, are you doing these things? There was no effect. No effect at all. So these teens are telling us, this isn't helping me. Which brings up the really important question. When we're bringing in these social interventions, we're asking people to engage in these groups, what are we really doing here? What's the problem we're trying to solve? Are we, for instance, just encouraging folks to mask? In which case, what do we do about that, and how do we do better? So again, as I mentioned, a lot of these interventions historically are about teaching social rules, right? They're about knowledge-based, and their theory is like you have these sort of didactic things, and you model behavior, and can lead to role play and skilled outcomes. And there's lots of different theories of this. This is a example from a widely used knowledge training manual for the understanding the feelings of others. There's 5 steps in case you wanted to know. Those are the 5 steps. Good, now you know how to do it. But I think the important question from here is, can we do better? And can we learn from this community to advance the idea of neurodiversity affirming approaches for interventions? Ones that don't require or focus on teaching people to mask, but instead to be who they are. So how do we do this? Well, we're going to talk now for a little bit about both examples, but also some principles. And I think the first principle we need to remember is that when we're doing this kind of approach, the first principle is it's not about fixing broken people. It's about creating spaces where people of different backgrounds and ways of being can more effectively be and feel comfortable being who they are. And one thing we do know, and I'm going to go ahead and assert this in 2025, is that when we do that, when we create those sorts of spaces, it is better for everybody. And so if we can do that, we can hopefully not only create spaces that are more effective and meaningful for folks on the spectrum, but for everybody. So how do we engage this question? Well, hat tip to Jerry Dawson, Lauren Franz, and Stephen Branson, who kind of put out the first kind of shot across the bow in this field in 2022. We're talking about early intervention. And what Jerry and the others have said is that we're talking about this idea, we first need to think about this idea of neurodiversity and this idea that we're thinking about autism as sort of part of the spectrum of ways of being. And that when we're trying to think about neurodiversity, affirming early intervention, is what she's talking about, we need to challenges autism researchers to think about what is our goal. Again, the goal should not, she argues, should not just be loss of diagnosis, right? What does that really mean? What are good social outcomes? Are they adaptive? Are they social? Are they stigma reduction? Are they communication? As Marjorie said, I now run a department focused on life course outcomes, so we spend a lot of time actually trying to think about what are those outcomes? What does that mean? What's good? What are good outcomes? And what can we do? And so again, I think one of the things that they really make a clarion call for in this article is the inclusion of autistic voices, recruiting autistic researchers into our research teams, encouraging expression of the child's needs in whatever way they can communicate it, and that the goals to the best of our ability should involve shared decision making. And the idea is that we should take a neuroscience and strengths-based approach, which I've tried to articulate to you a little bit here today. Also, when we're trying to identify NAIs then, what are some broader principles when we move across the lifespan? So one is thinking, again, beyond early childhood. And that we should reaffirm then the goal of intervention, which is focus on supporting strengths, including social strengths that individuals have. And we need to create environments that foster these strengths while at the same time not ignoring or downplaying the challenges of autistic people. I think sometimes when we get into the space of strengths-based approaches, that can rub folks a little bit strange. So they're like, well, yeah, we can focus on strengths, but somebody might still be having a hard time, and we can't ignore those. And actually, it's a mistake to think that those things are mutually exclusive. We can do both, and I would argue we must do both. We can identify then venues, approaches, and tools that, for instance, allow strengths to be more evident even in the face of those challenges, rarefied spaces. And there's a growing body of interventions that do precisely this. They impact those same challenge domains that are traditionally targeted, but without explicitly doing so. They achieve those same goals that have long been targeted, but via a different and, I would argue, perhaps more humane set of mechanisms and contingencies. So I want to tell you about some, I'm hoping, I don't mean to be presumptuous examples, although as we'll talk about soon, we're starting a project where we're actually working with members of the community across the country and the world to actually better define what these are. So I would argue that, for instance, in a performance-focused approach intervention, remember performance was the 30%, right? If we can focus on that, maybe this could be done in an affirming way. So how would we do that? We might use, for instance, targeted activities, a context where folks have the opportunity for repeated practice in a context that is inherently socially reinforcing. And the idea is that this can lead to sort of skilled social outcomes. So I want to tell you a little bit about this program called STARI, Sociodramatic Affective Relational Intervention. This is a model some colleagues and I developed about 20 years ago, and was originally designed, we didn't have this language for it yet, but the whole thing was we were responding to folks on the spectrum who were telling us we're not enjoying and we feel like we're being told what to do in our existing approaches. How do we, and we said, okay, how can we center what it is that you want? And this is a program that's based around centering the experiences of autistic people, creating opportunities through things like improvisation for folks to develop their own ways of being socially and having contextual social reinforcement as sort of a key priority. Those are the sort of simplified version. But STARI is, importantly, there was no teaching of social rules in STARI. Instead, it's a model where they're given where folks are given a context where they can have successful, fun social interaction. And so we've done a number of studies on STARI over the years. For instance, in one study years ago, we looked at multiple different time points, beginning 6 weeks before, 3 weeks before, baseline, 3 weeks in, 6 weeks in, 3 weeks out, 6 weeks out, according to a number of outcomes. And we find, for instance, emotion recognition measures, as well as parent report and teacher report measures, changes through endpoint, and actually also changes through follow-up. These changes maintained for these folks. And importantly, this, as far as I know, this was the first study in the adolescent literature to show what we were calling maintenance, what we can call maintenance effects in this way, which have now replicated in every study that we've done on this approach since then. Importantly, some of my former grad students were wondering, hey, we've seen these effects in a number of different studies. Again, we've have tons of STARI studies at this point. Does it affect social knowledge? Meaning that without actually teaching rules, do folks on the spectrum learn these rules? And the answer is actually yeah. So we don't have to teach them explicitly. It's actually not about that. So in a recent paper, actually, this is also hopefully going to be out very soon, we did what was, as far as I know, the first blinded RCT of social intervention for teens on the spectrum. So we randomized folks to STARI versus something called FACT, Fun Activity for Children and Teens. We closely matched every aspect of the project, and we did not, nobody was made aware of which group they were in. We actually asked afterwards, and they did not know. They guessed. And we looked at a whole bunch of different outcome measures, including self-report, parent report, peer report, observed interaction, and also EEG-based metrics in just 10 90-minute after-school sessions. And again, as I said, the idea is we really tried to tightly match these approaches because up till now, the challenge is most of these interventions are very confounded, right, with expectancy effects from parents who are like, okay, like I'm getting a thing as opposed to waiting for a thing. And what we find, interestingly, is that on parent report measures, there was a parent report effect. So meaning there was no effect of the actual interventions per se, but parents who thought that their kid was in STARI did better than the parents, their kids did better than the parents who thought that they were in the other condition. So once again, say it with me now, whoops. But important to know, actually, that these expectancy effects are really shot through in a lot of the work that we do, and we need to really be careful about who we're asking and why and how. But on some of our other measures, we actually are seeing effects. So on this N170, that thing that relates to emotion recognition, efficiency of processing social information, that actually does improve in STARI, including at 10-week follow-up. And also in terms of reciprocated friendships, we asked kids in the groups, after each of the group about who is their friends. The folks in the STARI group became friends more quickly and stayed friends more quickly, although interestingly the other group caught up over time, suggesting again, it's not about what's good or bad, but the rate and way that these friendships are being made. And we see a very similar pattern with blinded raters rating observed peer interaction. So that's an example of one type of model. Another type of model that's sort of similar is an inclusive context model. Blythe Corbett, who used to be here for many years, is now at Vanderbilt, and Susan White and I had a R01 together where we looked at sense theater compared to sort of a knowledge-based approach. So sense theater, for those who don't know, is not the same as STARI. The big difference really is that sense theater really is a theater program. They make a play. For those who were here, when she was doing that here, she writes a whole musical, it's wonderful. But the key thing is that the sort of active ingredient is it's about training the peers, not the kids on the spectrum, but the peers to create an inclusive space that is not about teaching the kids on the spectrum to behave differently, but instead to sort of welcome and accept and understand them for who they are. And we found in a recent paper significant effects on a number of different key outcomes there. It's another example, again, of maybe a performance-based approach. And importantly, we can even operationalize features of context that can be more inclusive. So in a recent paper that my grad student Morgan McNair published in Development in Psychopathology, we tried to say, all right, what if we just create spaces that vary in certain social qualities, but aren't interventions at all? Do we see differences in social interaction and opportunities? So we had these groups of autistic and non-autistic teens come into the lab, and this was called the pizza party paradigm. And the pizza party paradigm, there's 3 different parts. One is literally pizza. By the way, this is an R01 that was funded right before COVID, so we collected a bunch of data and then had to stop because bringing kids in during COVID to eat pizza together for an hour was not great in 2020 and 2021. But we did have some good data. And then, so the idea is that this is just sort of a broad context. Then we have different kinds of incidental social demands. So that's an incidental social demand there. Then we also have a context of physical social demands. So we brought in giant Jenga, like sets this high. It's pretty fun. And the idea is that kids can choose to interact or not. They're not given any motivator. We don't say you have to do this or else, right? They just say here it is. Here's how you play if you want. And the idea is you can interact without any verbal social interaction, right? You can just play Jenga together. Or you can verbal social demand one, so they play the game apples to apples, for those who don't know. And what we find is that when blinded raters code these interactions, they find that in terms of positive peer interaction, low-level peer interaction, there's so significant differences, particularly in the verbal social demand setting. So meaning if you're just talking about, I want to create an after-school program, I don't want to do an intervention, I just want to say, can I create a context that's going to be inclusive and not about teaching folks to behave in any other way, that at least that apples-to-apples verbal social demand context seem to work best for folks on the spectrum. We can also think about this in the employment setting, as Marjorie was talking about. So we were the US site for an international study a few years ago trying to get at what our neurodiversity affirming, or what our effective supports context for folks on the spectrum, and we could actually, we got feedback from a lot of autistic folks from around the world, and we found certain features of what, for instance, a neurodiversity affirming and inclusive context could be. So, for instance, there was a priority for supporting work experience and vocational training, as well as educating staff about autism with an emphasis on inclusion and environmental awareness for the needs of folks on the spectrum. But importantly, we also heard that we don't necessarily need comprehensive training for all employees because that risks sort of stigmatizing folks, but instead focusing again on individual strengths. And so we can focus, for instance, on supporting developing independence in other areas, thinking about using alternatives to traditional spoken interviews, considering thinking about individual sensory preferences and needs, to ameliorate those challenges while still uplifting the strengths of those individuals. Around the question of disclosure, this turns out to be very, very complicated, and we can get into a whole discussion around that. We can also think about this in areas around, like, for instance, mental health. So we have a project that has recently gotten going called Enhancing Mental Health Practices for Autistic Adults Collaborative Team. This is a community-based participatory study where we are working with autistic folks across the whole range of the spectrum, including minimally verbal folks and folks with very high support needs, to develop methods for creating spaces for shared priority setting around mental health. And importantly, the whole key to this is centering and prioritizing those individuals' perspectives and thinking about what level of engagement and need is required for them to be there, and really kind of thinking out of the box so that we can actually get their perspectives. And sometimes that involves us having to really radically change our own behaviors and expectations around what engagement can look like. But importantly, if we do this, we can maybe really think about addressing mental health needs in a very different way than we have before. So in a recent paper, Eva Gerba, Dina Gassner, and I tried to lay out some principles for what neurodiversity affirming interventions then might be. They involved, for instance, facilitating interdependence, not just independence across the lifespan, recognizing, of course, that we are all interdependent, right? This idea of independence is sort of a little bit funny, right? Because, like, who among us is truly just independent from everybody else and doesn't have any supports? Are you going to go to live in the woods by Walden Pond in Massachusetts? Because, guess what? His mom did his laundry too. And if we can appreciate that and understand that autistic folks might require different amounts of interdependence at different times, we can perhaps better create social contexts that can be effective. We need to prioritize physical and emotional safety as outcomes. That's something we hear a lot from the community, that if we want to talk about meaningful outcomes, we need to make sure that, this is really, this needs to be at the top. That we need to think about in context and spaces, and I hope that's evident from everything I've told you, that a lot of it is as much about, it's in some ways more about the way in which you frame and create your social spaces as it is about the things you do. The goal is to maximize social strengths and consider the physical and social environment. And crucially, to learn from intersecting communities, because guess what? Autism is not the first space where we've thought about first population where we thought about affirming interventions that allow folks to be who they are in the way that they are meant to be. And so we can maybe learn from others for how they do that, particularly among folks who have intersecting identities, overlapping identities. And so I am proud to share that we have a new project that's just getting going now, a 2-year funded project, to identify and actually create measures of neurodiversity affirming interventions by listening to the autistic community, caregiver community, and clinician community, and trying to identify measures that both are common and discrete among them in terms of what they're talking about here. Because the real risk here is, I've just spent all this time using this term and talking to you about it, but like, what the heck does it mean, guys? I've just given you a bunch of principles, but like, we kind of made them up. I mean, we derived them from various different feedback, but like it's not yet an empirical construct, and so the challenge is there's a real risk of it becoming like a marketing term, and one that creates more confusion than validation for the very people that it's needed for. So I would argue that we are really desperately in need of some measurement properties for this, and so we're trying to work on that now. So the other things that we're working on now, and then I'll wrap up and leave plenty of time for questions. One is, again, working with some of our autistic community members. We're looking at some constructs that are of value to them. Jared Richards, my grad student, is doing a study on the phenomenon of autistic burnout, trying to understand both what that is in an integrative way, and then also how autistic burnout itself differs from the consequences of it, so that we can kind of know what and when to target. We're doing some work with the actor Alan Alda. He has a intervention actually for science communication and teaching scientists to be more effective communicators. Guys, guess what? It's not that different than some of the stuff that we do for folks on the spectrum, just to be really clear. but we're kind of trying to partner in some of that work and do some larger scale work nationally on that. We're doing some work I'm really excited about with Jessica Schleider at Northwestern on single session interventions. So, for those who haven't heard about this, these are mental health interventions that can literally be delivered in a single session. This is one of the many, as in 30 to 40 minutes on a computer. And this is one of these many places where in the autism world we're kind of behind the ball. The child youth mental health field has been on this for about 5 or 6 years. There's been papers in Nature and Science all about these. There have been meta-analyses galore showing that in adolescents, for instance, you can do these interventions and show significant effects compared to a matched control at 3, 6, 9 months, even a year later, in terms of attenuating, for instance, the symptoms of depression, anxiety, and loneliness. So we've done published the first study on that in autism, and we're going to be doing some follow-up work there. We also have a couple of training programs we're doing. We're really trying to push out this idea that we can deliver these online trainings to increase accessibility of some of these concepts and also hopefully improve practices. So we have a training, which I'll tell you about in a moment, for direct support professionals, one-to-ones, school aides, RBTs, as well as even caregivers, administrators. That is co-taught by autism scholars and autistic individuals together, focused on debunking the myths of autism with science, and then also building up an appreciation of the lived experience of autistic people. We also have a training called SPIRIT. It's a very tortured acronym. Don't look too close. But it's a model for training mental health providers to stop turning away autistic people. As we know from some literature, somewhere between, for instance, in New York, somewhere between 70 and 80% of youth mental health providers will turn away autistic people even if they've come to the door for the thing they claim to treat. So they'll be like, I treat anxiety. Great, hi, I'm here with my child for anxiety. Fantastic. Oh, I'm sorry, you said he also has autism? I can't help. We are training them not to do that. I'm going to tell you about that in a minute. We also have a partnership just brand hot off the presses with Specialist Derna, which is a European and Canadian program focused on supporting employment for a certain segment of folks on the spectrum. We're going to be evaluating that program together with them. And I'm really proud to share, because a press release just went out about this new large project we're about to do, trying to bring together the autism community and behavioral intervention communities together to find ways to better and more effectively center the experiences of autistic people to advance effective dialogue around this topic, rather than continuing to push each other apart. And I'm happy to elaborate on that if we want. Just a quick note, the button about these interventions. So, SPIRIT is run by this absolutely amazing team: Dina Gassner, Lauren Moskowitz, Allison Namias, and Rebecca Sachs. Allison Namias, by the way, who trained here at the Mind. Hi, Allison. For our initial data on 240 mental health providers who we've trained using this model shows significant improvements, for instance, in self-reported confidence and competence, and we're actually looking at now changes in things like, are they actually taking autistic folks onto their caseloads and keeping them on their caseloads? That's information about that if anybody's curious. And then for the ILEA program, this is developed by myself, Jackie Gates, and Eva Gerba. We have a number of members of our team, and Jackie's actually looking at this for her dissertation, but some of our initial work suggests that folks individuals who are attending are feeling greater confidence and competence in working with autistic people. Some of this is actually from cohorts of nurses who have changed their practices in hospitals based on taking this program. They feel more prepared to work with autistic individuals, and they feel that the most important part, crucially, is learning from the lived experience of autistic people, not those of us telling them about the science of autism. Important to remember that. So I just want to take a moment to thank the collaborators on the work I've talked about. I want to thank my team, including this old picture, which I dug up just last night for the illustrious Dr. Meg Tudor, who you might see here wearing a much less floral outfit than she is wearing today, as well as as well as other members of my team. It was really cool to see this because most of these folks have now gone on to great careers in this field. I'm so proud. As well as past grad students. Hi, Kat. My team back at Stony Brook, as well as our fantastic team over at Drexel, and all the participating families and individuals, of course. And thank you for listening.
I think social skills training means various things to various people. And I think that just plain pure skills training, just putting on the record, is never what the Mind Institute's training program intended to do. There's a whole wide range of things that can be done, and ours was really, as much as anything, to get the kids together to be with each other and, you know, let them have that wonderful opportunity of potentially developing a friend, and also to incorporate all the people in their lives, their parents, in helping to help them. So just how to say it. But the question that I really want to ask is, so I was thinking about the intervention work you did with Blythe, because of course she did Sense Theater while she was here.
Yeah.
And I remember the great day when one of our social skills participants got cast as a palm tree, and it was wonderful. It was a great experience for this individual. Have you done any work trying to follow up the individuals? Because I think it would be a super interesting study. You talk about outcomes.
Yeah.
To take some of the different approaches and then to look at kids who've had those approaches in their childhoods to see what the outcomes are. Have you thought about that at all, or do you have any experience with that?
Yeah, thank you so much, Marjorie. So I want to address your comment first. Just to be clear, and I hope my zealousness did not betray this intent. I certainly have no intention, and I hope none of this work did this, of disparaging actually any of the approaches that are out there. I mean, the evidence that we have is that they, as you said, there are different things for different outcomes, and that by and large we're seeing effectiveness from, you know, things are, you know, even our meta-analysis saying, better than nothing, please don't do nothing. But also, I think a couple of things. One is, in a way, for the purposes of illustration, I'm creating a little bit of a false dichotomy in what's really dimensional, right? So,
Yeah.
so you know, there are programs out there, and this is true, that are truly knowledge. We're gonna sit down and we're gonna learn the rules in the book, and that's sort of at one end of the spectrum. All puns intended. On the other end is, you know, might be a program like Starry. There are even programs that are more performance-y. There's this program out of University of Kent. That name I'm forgetting right now, that's like even further in that direction in terms of having sort of no explicit goals for any given context at all. And then most sort of exist somewhere in the middle. And I think my point is that it's important for us to then be thoughtful about what our outcomes are and what our processes are, and to not just conflate all things together.
Sure.
Right? And so my understanding actually, having admired and read actually a lot of your work, is that it is actually the work that you guys have done here is an example of one that both, you know, primarily, you know, creates context for performance and then also leverages opportunities for directed learning. And, you know, in reality for many people, it's probably going to be some mix that's going to make the most difference for any given
And
outcome.
different things work for different people
Yes.
at different times in their development and different families. You
Yeah.
know? But I
Yeah.
think all of us could take a lesson of, we probably should be looking at some of these interventions and going back. Like I have also
Yeah.
sat and thought, well, that was 20 years ago. I should go reach out and find out what folks are doing, and even doing it across interventions would be super interesting.
Yes, so to your second question, so we have done this. So Starry's now been done for 20 years, you know, around the world now, and so obviously we haven't followed up everybody. But some of our original cohorts from outside of Boston, from the early 2000s, we are still in touch with and have some follow-up. And, you know, and what's really, the part that is most, I think, meaningful actually to me, I mean, let me step back. We haven't yet like given them questionnaires now and said, and, you know, so sort of tested outcomes, or even looked at, I'd love to look at employment status, for example, right? Like there's a lot of cool things we can look at.
That'd be awesome.
Yes, we should do that
We should
together.
do that.
Let's do it. But what I can say, what I'm really proud of, is many of the friendships that were made in that program have stuck around.
Yep.
And that's a really important thing to remember, because again, you know, as you said, it can mean lots of different things for lots of different people, but one thing I think we can all agree we're hoping for is folks building relationships that endure. Mm-hmm. And so, you know, I think we shouldn't sleep on the fact that the places that we hear that finding, and we hear that, it sounds like you hear that too, I think that those are the places to go digging for gold, right? I'm in Sacramento, so I need to keep making gold references. But that's where we need, I think it's a great idea.
So I want to make a comment and a question. I'll follow Marjorie's example. I think the comment is, what you talked about, I think is a great example of the value of the neurodiversity perspective and listening and learning from autistic individuals. I think it's really nicely incorporated in everything you do. So I think that's great. Then, so here's the question though, is, with the new category of profound autism, have you thought about how that fits or doesn't fit with the work that you're doing and how you can incorporate people from kind of the full spectrum in this kind of concept and in the work?
Absolutely. Thank you for asking that. I promise I didn't pay him. So actually that project I mentioned, Impact, which I can show you just the words, but that's literally what it's for. So it's a new funded project, I guess I'm allowed to say it aloud. So this is one of our PCORI funded projects. And that was the whole aim, actually, was to say, one of the things that PCORI cares about is ensuring that individuals who have been underrepresented in guiding their own care get to do so. And we said that's the population that has been most underrepresented in guiding its own care their own care in terms of mental health outcomes. And so that's actually what that whole project is about. And we're working, for instance, with a local agency that that primarily serves folks who would be described in the way that you've said, folks who are living there, have very significant support needs, and we're actually sort of building out ways to engage more effectively with them. We're also working with them, and this has been really neat, with that same organization. They're called Bancroft. It's a wonderful organization in southern New Jersey. One of the oldest, actually, in the world, I think, in the country, that works with folks with significant support needs. To create this is funded by a generous donor, a modified version of Starry for that population specifically, because in addition to their mental health needs, the social needs of that population are almost uniformly neglected. And the really interesting thing to me about that work, we've already started doing that now, is we've been sort of just looking at what they're doing currently and learning from their providers and learning from the folks in that group. And the thing that really has fascinated me so far, and bring me back in a year or two and I can tell you if this is still true, is when I talk about this sort of knowledge versus performance idea, people often ask, well, isn't that just for folks with less support needs or higher cognitive ability or language ability? But when we actually are looking at the things even that are just being done kind of endogenously in these groups for these folks, for these ostensibly high support needs folks, their social stuff actually looks a lot more like a performance-based approach, right? Because these are not folks where sitting down and saying, well, let me teach you this rule, and let's do this thing one at a time, and can you say this back to me makes any sense? But guess what? Having enriched social opportunities where they're getting a lot of contextual reinforcement and learning, hey, when we played this game together, I have fun. I'm going to come back. And the outcomes that they see are things like coming back, like choosing to show up as opposed to, to choosing to leave or to throw the chair, right? That's what we're seeing happening. And this is just a few weeks ago that we sort of started to discover that. And it's been really blowing my mind and helping me to rethink the way I've approached this question, right? Rather than being uniquely for folks with low support needs, this actually may be uniquely and unusually the way in for folks with more significant support needs, which again, to me, highlights from the neurodiversity perspective the importance, especially, of listening to those populations that we don't usually give a chance to tell us what they're thinking.
So as far as I know, there aren't too many social skills programs that focus on the potential nuances of girl friendships and boy friendships being a little bit different. And I'm wondering if you've looked at the specific outcomes based on gender of maybe some of your social skills interventions or in general.
Great question. So the answer is yes. Yes, we have. So Alan Gerber, I should have showed that slide, but did a a kind of aggregate review study where we pulled together data from all of the past STARI studies and looked at things like co-occurring mental health conditions, as well as gender, as well as sex, as well as I think like med status as kind of moderators. And so we do see some differences by gender, but fewer than I would have expected. I think the interesting thing for me, and I welcome your thoughts if you think otherwise, is that, you know, this is a content agnostic model. So meaning it's not about saying this is, you know, what you do if you want to make a friend or you want to have a boyfriend or a girlfriend, or what you want to do if you want to be seen as cool, right? It's simply a model that is creating what we call sort of these enriched social environments where folks can, you know, kind of come as they are. And so at least in theory, I see it as a little bit more than gender agnostic too, meaning a person can show up with whatever their gender expression or identity is, and they should, if it's working right, be getting, you know, a sense of value for that. So I see it as less pegged to gender in that way. That said, I am absolutely happy if you want to tell me that you think differently. And okay.
I think my question is, a lot of individuals who participate in social skills, they also have other co-occurring mental conditions like autism or anxiety or ADHD. And my experience as a social skills leader is a lot of the interventions that we provide do really great at, you know, providing interactions with peers, but they don't address some of the challenges that the co-occurring conditions cause. For example, like individuals with anxiety, they feel so nervous to even try or attempt to interact with peers. So I'm wondering if SDARI can also be applied to help with the full picture.
Yeah, great question. So I have 3 answers for you. Number one is, I think a key thing about STARI is that from the beginning, it has had very few exclusion criteria. So meaning, you know, folks with co-occurring mental health challenges or even behavioral challenges, you know, often we have not said, this is not for you. In fact, our very first iteration of the program ever, which is well over 20 years now, which is crazy. I'm old. The group that we sought was folks who had been kicked out of all of the other programs in our area because of those challenges, and you know, was successful with them. So at least as far as them staying in the program and feeling good. So I do think we've prioritized saying that, you know, whether you're anxious or, you know, have you know, externalizing, you know, presentation, you know, that doesn't keep you out. It's our job to make this space work for you in whatever way works for you. The second thing I want to say is that one thing I've thought a lot about, which I feel like a lot of folks in the field have thought about, I haven't seen done as much, maybe Marjorie, you have, like, I often look at anxiety as like the egg that we need to crack when folks are coming in the group, the shell of the egg. I've thought a lot about whether or not it'd be neat to have like an adjuvant sort of brief anxiety intervention, you know, for folks who, if we're really struggling, to be able to help them more effectively access and stay engaged, you know, with a program like that. Because it is tough, right? It does require being willing to sort of show up and be there, even just show up and be there, period. That said, I can say we do have data on that. So there's a 2019 paper by Erin Kang and Tessa Clarkson that looked actually at both anxiety and ERP correlates of anxiety as both predictors and outcomes. And we find that, you know, the program does lead to reductions in certain kinds of anxiety, like social anxiety. But it seems to be moderated, to your point about different things for different types of people and different needs, by certain baseline ERP indices of anxiety. So it's sort of like if, I have to remember the specific finding, but kind of heightened, kind of reactive type anxiety up front seems to attenuate the anxiety response, like how effective it is for addressing anxiety for that subgroup of people, but not for a different index of anxiety. So the answer is like yes and maybe and probably just for certain people, and that's why we need to study this stuff better.
A question for you about what are you going to assess, or what your outcomes will be in your project with Especialisterni? And the second
In project with which project? Oh.
Especialisterni, yeah. And the next question that I have was, do you envision challenges in terms of changing, regions in societal problems?
For Specialist Turner?
Yeah, for implementing that here in the U.S.
Great question. So, and this is to the credit actually of Specialist Turner in their work with HG and putting this together, is actually literally phase one of the project is just about the question you just asked. So we're using a community partnered approach with Specialist Turner and both participants in it and staff and others as the community that we are looking at. And we're doing kind of a set of both qualitative and quantitative review of both their existing measurement system, their participants who've been in it, both internationally and already in the U.S., to do two things. One is to kind of help kind of better elaborate the theory of change together with them to say, okay, so like what are the specific things that this approach should do? Because I think one of the themes I hope of this intervention part is, different approaches do different things for different people in different ways, and if we can better specify that, we know better what to measure. And so the point is to learn that from them. We also want to incorporate what we've learned from the autistic research community. Hat tip to Dora Raymaker and their colleagues, in Oregon, who are focusing on improved sort of autistic-centered experiences, employment experiences as outcome measures. So it may be, for instance, that like we see changes in folks feeling included, but maybe less changes in folks having a sense of competence in their work when they start. I'm making it up. I have no idea if that's true. Don't quote me on that. But you know what I mean? So the idea is we can differentiate in that way. And then the question of the cultural translation, that actually is like sort of nominally how we actually sort of got involved in the project, is they sort of were asking for folks who are interested in working with them to think about that cultural adaptation, which, to be fair, I think we started discussing this with them last year, and so the cultural setting of employment might be very different now than we anticipated when we first thought, although we will see.
Out of my area, I was just thinking about what we've learned about knowledge and performance, and sort of the tension maybe also between inclusion and the fact that you're finding that maybe it's easier for autistic kids to make friends with other autistic kids, right?
Yeah.
And so I'm wondering if you've thought about or done any work taking the information you've got about how they're interacting and helping the neurotypical kids in their classroom or their programs think about how they might change their behavior to help their autistic friends.
So right, I mean, I just made this whole point about context, but we need, So how do we do that? I mean, I would say, folks have gone there already in some ways, right? So again, that is part of what the SENSE program really, I think, does well, and the BLITHES program, right, is sort of creating these environments where the focus is on teaching those peers in that way. I also, need to acknowledge Connie Casseri's work, right, which she's done some really remarkable work creating these sort of inclusive classroom spaces. I think in case it's not clear.
You don't have to have an answer if you don't want.
Well, I have thoughts. I have a thought, which is that as a when I wear a few hats, but as a sort of intervention scientist, I'm really a mechanisms guy. I'm interested in sort of what processes are doing what for what, and so I think the thing that I'm really interested in figuring out how to do there is more precisely figure out what peers can do that either potentiate folks feeling included and also impede it. Because I do think, I have, candidly, and I've gotten criticism for this, in a lot of our groups, our STARI groups, for instance, we don't have non-autistic peer inclusion, right? It's all folks, on the spectrum, I think in part because we want to create sort of equitable opportunity for everybody. But that's also because I've seen in other contexts that inclusion go well, and I've seen it go wrong, particularly among, let's say middle school and teenage, and high school age kids. What do middle school and high school age neurotypical kids typically do? They create social hierarchies, right? They find ways to figure out where they sit in those hierarchies. Many of them just do that normatively because that's developmentally what's happening at that age. And I worry about seeing that and what that does when we're trying to create a space where we're telling folks, look, here you get to be who you are, and we want to help build that up. So I both love that idea and I'm scared of that idea.
So it struck me about the connections between autism and later development of homelessness, actually, when you brought up the topic of basically long-term social interactions as being so important. I mean, having long-term social relationships and then employment. Those are literally the two biggest risk factors for homelessness later in life.
Yeah.
The problem seems to be rising in the United States. There's a higher number of people who are homeless, or people who have autism who are homeless than there are in the, general population. It's like overrepresented in that population, along with other neurodevelopmental disabilities. But I guess I was kind of wondering if that would be it's kind of a comment, like, would that be a viable outcome, long-term outcome for, when you assess your interventions? If you're able to keep that initial cohort and check in 20 years later and see, hey, how many of these people were reported as being homeless versus we'll say, even larger cohort of people who did not receive the therapy. And you may notice a difference because you're literally directly trying to address those outcomes through your interventions. So it's sort of a comment, and I kind of want to hear you riff on that.
I like your bow tie. I have not thought about this question directly before, but it's obviously a really profound one because, again, life course outcomes, pretty important one is being housed. I think it's a lovely idea, and quite frankly, I think we just more broadly need to think about what are the things that we were doing earlier that are predicting folks being housed. I think the other thing to be mindful of course, is that this is a huge amount of the variance in this is going to be explained by socioeconomic status, no matter what. Because and this is something I hear a lot. I was just giving a presentation a couple weeks ago, and there was all of this discussion about young adults on the spectrum who are maybe stuck at home and not really working and not really doing much, and parents sort of saying, well, at what point should I do what, just, kind of push them, and, at what point do I, sort of, not tolerate it and whatever. And the thing that I and a couple other, speakers also said is I was like, well, but what's the alternative, right? And you say, oh, well, they're sitting here at home and they're not doing anything, and, I get so frustrated. Well, the alternative is what you're talking about, right? The alternative is literally, asking your child to not live at home. And I hope, I think anybody wants somebody to be unhoused. So I think, this is sort of half an answer to your question you asked me, Ruth, is we need to think carefully about socioeconomic status and availability of supports for housing anyway. We need to think about what factors at that time are the things that an individual might need, including socially, right? And that, we might be talking about very incremental outcomes at that time. And that, yes, if even after controlling for that, even after addressing that, we can look at social interventions or any earlier in life intervention as something that's going to protect against that, we really should.
The UC Davis Mind Institute was founded in 1998 with the promise to reduce and prevent the disabilities that can be associated with autism and other neurodevelopmental conditions. Every day, our clinicians and researchers make progress on that promise. Our groundbreaking research on autism, Fragile X syndrome, chromosome 22q11.2 deletion syndrome, ADHD, and other conditions associated with disability are helping affected individuals achieve their fullest potential. Please visit our website or our social media platforms to find out more about current studies, upcoming events, and how you can help make a difference.